First question is about biometric access. Biometric access to your medical records, to your health information, and to medical care. That's the direction access to all of that is moving in. So how will MAHA leaders prevent the healthcare system from becoming inaccessible to people who refuse to use biometric access systems? And then there's a convergence of public health and healthcare and the information systems for those. So what will MAHA leaders do to give individuals the ability to control where their data is stored and opt out of having their personal information stored in centralized state and federal databases if they choose, without losing access to healthcare? Social determinants of health data collection. This is a big topic that we don't have time to get into, but it's information that is not medical information, but is considered to be connected to your health that's being collected more and more. So how will MAHA leaders advocate for people who want to limit the information included in their health records by excluding social determinants of health data? Social determinants of health data uses. How will MAHA leaders prevent this data from being used to create scoring systems, restrictions, and requirements that are applied outside of healthcare settings? Right? This could be used to create a social credit system, a scoring system. Clinical ambient AI and medical scribes. This is something that you touched on in your article about AI doctors. So these are medical assistants, AI medical assistants that listen to your medical appointment and take all the notes and code things. So how will MAHA leaders advocate for patients who want to opt out of having all of their interactions with healthcare providers automatically recorded by AI agents? Preventative medicine overreach. New pharmaceuticals designed to prevent cancer and other serious diseases are being referred to as vaccines. We saw this at the Stargate press conference on President Trump's first full day in office, right? They were talking about using, Larry Ellison was there talking about using all of this data from all of our, you have to understand the data is from all of our medical records. That's where the data is coming from, to create new cures, and especially mRNA products to cure cancer and things like this. So how will MAHA leaders prevent those new pharmaceutical products from being classified as vaccines and mandated on the public as a public health measure? Consumer data laundering. So medical records contain information that you directly give to your medical providers, but increasingly hospitals and other healthcare providers are able to purchase consumer data that's related to social determinants of health and add that to the information about all of the patients in their area, for example, that they might serve. So that consumer data is being mixed in with the medical data that you have directly given, medical information that you've directly given to your doctors. So what I'm saying is that this can launder consumer information into health information that public health authorities have access to. So how will MAHA leaders address this channel for government access to citizens' personal information? How will we ensure that the consumer data is kept separate under separate privacy laws? Public health exceptions to privacy rules. How will MAHA leaders address the need to update public health powers under HIPAA and other laws in light of this expansion of the kind of data that's collected about everybody and tracked about everybody? How will we update our laws, HIPAA, federal laws, and state laws too? And then the healthcare research convergence. So I mentioned the convergence between public health information and healthcare information. There's also a convergence between the biomedical research information systems and healthcare systems. Those are going to be coming together in the same information systems. So, how will MAHA leaders ensure that individuals have the ability to opt out of having their medical records, their personal health information used for research purposes, if they don't want that? Again, without losing access to care. And then the 10th thing is I mentioned a health information right to be forgotten. So this is a concept that has existed in law for a long time. This idea that you can withdraw your data from the system, that you can say, I would like the internet to forget about me and delete everything about me. Very difficult to do in the internet in general, but would MAHA leaders advocate for a way to withdraw, to remove your information from health information networks if you so choose? Because if it's in the network, authorities have access to it with or without your consent in general under I think federal and most state laws. So those are the 10 questions.
This is fascinating. I love the right to be forgotten. You were the first person who educated me on that, and I love that concept. That's a concept we need to expand upon and to come up with our own civil rights MAHA agenda about the right to be forgotten, and how do we push those things forward and make sure that this starts to become a part of the conversation, because no one's really talking about this right now.
Michael, do you know who owns your health information? Who owns your medical records?
I would imagine it's either Epic or Oracle, right?
That's not a bad guess. It's not you is the answer.
That's a good point. Aimee, unfortunately, we're just about out of time here. Larry Ellison, who founded Oracle, I learned this from your Substack, has come out and said, we're getting rid of passwords. In 2025, you access everything through Oracle by biometrics. And that's here right now. That's the age we're facing. And what are the elected officials going to do about this? Aimee, I'm so sorry. We got to get into the next segment here. I'm probably going to have you on to just do one of these questions at a time and to do segments on these. But I wanted to make sure I wanted to make sure we introduce people. Everybody subscribe to knowoneyouKnow.substack.com. Aimee is just doing phenomenal work I'm not seeing anywhere else. And we need to start these conversations rapidly, because we need to make sure this is getting into Albany and into DC. Right now, we have some friendly ears in DC, and we need to take advantage of that.